So I want to welcome everybody to our third episode of Ellie Connects, which is our continued opportunity to connect with all of you. Some of you are patients, some of you are volunteers, supporters, friends of ours in a relaxed and informational setting. We're really glad you could join us tonight. And in an effort to get as much from the doctors as possible tonight, we're going to ask everybody to put your questions into the chat. And then I'll make sure at 7:40 exactly that we start looking through the questions so that you get a chance to have an open discussion with the doctors directly, because these three women are experts in their field. You don't really want to hear from me the whole night. So let's make sure that the questions go in the chat and we'll get them each to answer. I will say, we know about Elaine. If you are a current patient in current treatment right now, and you don't mind sharing that with us, please put your name and email in the chat. We want to make sure you have what you need. We want to make sure you know what we offer, and we just want to check on you. So if you are currently in treatment and you feel like sharing, let us know. I'm checking off as I go. What is lifestyle medicine? I'm sure you've all heard this term before and have been intrigued by it, but don't really know what it means and have nobody to ask until tonight. We have a rare opportunity to hear from three prominent physicians who really believe that lifestyle medicine can help everyone enhance their own wellness. And they're going to share their perspectives on this important topic, like self-care. And what does that actually mean? Why giving yourself a timeout is actually a gift and an empowering way to take control of situations that are causing you unwarranted stress. And what they learned along the way from their personal experience, and they call that live and learns, which are shared through their fabulous new workbook. I'm holding it up here, Paving the Path to Wellness, which is a guide to thriving with a healthy body, a peaceful mind, and a joyful heart. I just love that message. These incredible women collaborated and co-wrote this easy to use workbook, and they're going to explain how all of us can take control of our wellness, no matter what state our wellness is or isn't in tonight. You're going to leave here with some concrete steps that you can take. I want to make a quick introduction of the incredible doctors that are here. I'm sure I'm going to mess some of this up, but you'll bear with me. Dr. Beth Frates is a lifestyle medicine pioneer. Are you waving, Beth? Good. And president-elect of the American College of Lifestyle Medicine. She is passionate about using healthy habits like exercise, nutrition, sleep, stress reduction, social connection, which is what Ellie Connects is all about, and avoiding risky substances to help people, get this, prevent, treat, and in some cases, reverse disease. I think we all need to hear about this. She is an award-winning teacher at Harvard. We've heard of Harvard in here. And the co-author of a lifestyle medicine handbook, which is ranked one of the top 100 best medical books of all time, which is impressive. Beth is passionate about lifestyle medicine and helping others. And she's so kind to be here. So I'm going to just keep introducing, and then I'm going to give you a chance. Dr. Michelle Tollefson, did I say that right? Is an obstetrician and a gynecologist and a women's health lifestyle medicine expert in Colorado. So she's 2 hours early. She's joining us, which is so nice. And she's a professor in the health profession department at Metropolitan State University of Denver, where she created and oversees the lifestyle medicine program and wellness coaching lifestyle medicine pathway. I think that's amazing. She is a 2-year breast cancer survivor and thriver, and enjoys spending time in the Colorado outdoors with her husband and 3 kids. And I'm so honored that you're here tonight. Thank you so much. Not the last by any, I'm saving the best for last, Dr. Amy Comander, our board member. I'm so proud, Director of Breast Oncology and Survivorship at Mass General Cancer Center in Waltham and Newton Wellesley Hospital. She is the medical director of the MGH Cancer Center of the Waltham location. She is the proudest board member of the Ellie Fund. So proud that she ran the Boston Marathon for us last October to support Team Ellie. And get this, she can't wait to do it again in 2022. She has a passion for improving the quality of life and outcome of cancer survivors through lifestyle interventions, including exercise, diet, and this is my favorite part, mind and body strategies. In collaboration with Dr. Frates and Dr. Tollefson, she has launched Paving the Path to Wellness, a lifestyle medicine-based program for breast cancer survivors. She has co-authored this book with them. And before we ask Dr. Tollefson to share her personal live and learn, I just have to ask you, Dr. Comander, how do you write a book with two other women that happen to be doctors, all professionals with busy personal lives, serve on the Ellie Fund board, take care of hundreds of patients who absolutely love you, run marathons? It's just amazing, Amy. Have yoga events. Say a few words about this project and what it was like working with these two amazing women.
Well, first of all, Meredith, thank you for your very kind introduction. It's really such an honor for all of us to be here tonight with this amazing group over Zoom. Let's just acknowledge that. So it's really such a pleasure to be here. And so thank you. And so you were asking specifically about what it was like to work on this project. We were reflecting on this a little bit today because, you know, the past 21 months have been very challenging for all of us. And you know, using Zoom for events like this was completely novel for me as well. But one really interesting thing, you can, you know, whether you want to use that term silver lining, Michelle, Beth, and I met every Friday for, you guys tell me how long, certainly a long time, certainly most of last year and part of, you know, this year. And we like worked on this book, like over Zoom together and collaborated. And it's just been such an amazing process to work with them. I feel so grateful, but really shows you how it's so interesting what you can accomplish, you know, now when you use technology such as Zoom to connect with others. You know, Michelle's in Colorado, you know, different time zones. So it's really been a pleasure. And I've learned so much from both of them. And I'm so grateful for that.
Oh, that's so great. I'm showing 3 slides tonight. So this is not like a slide type situation, but I want to make sure that you don't feel like you have to take notes and you can see what they're talking about. So here I went to law school and not Zoom school. So I'm sorry if I mess this up. So this is, oh my gosh, please, Lord. Can everyone see that?
Yes.
Okay. This is a slide that is not the slide that I wanted to show. You're all so nice. What? Oh my Lord.
But we could start by talking about this
No,
one.
we're good.
Okay.
I got it. Amy, thank you. This slide shows the paving path to wellness and what our guests think we can all achieve if we decide to incorporate this philosophy of incorporating self-care as a serious part of our wellness. And Amy, if you could start by giving an overview of paving the path, and then I have other questions for the other doctors right off the bat.
This actually, just so you know, Meredith, I know sharing the screen is always a challenge for all of us. We see the self-care slide, but that's a great place to start, the self-care, because the reason we're all here is because, you know, this is a challenge for all of us, especially with everything that we faced this past, you know, almost 2 years, but also certainly after a cancer diagnosis, like learning how to care for yourself is just so important and very challenging for cancer survivors, and given everything that, you know, one goes through with cancer treatment. So I think this is a great place to start. And I think the paving wheel really shows how we can really optimize our self-care. So I don't know if you're able to go back one, or I'm happy to share mine too. If
it's so awful because what I'm looking at is the paving screen.
So, now we got it. We're good. We're good.
Okay. Go ahead.
Beth, would you like to explain the wheel?
Okay, sure. Thanks so much, Amy. Thank you. And thank you, Meredith. And thank you all for being here. So what we have is a path to wellness. And the three of us trained in medical school, and we learned all about the body, and we learned about disease and pathology and also pharmacology. And the things we didn't learn about, but we share today because we studied them in depth, all three of us after medical school, are some of the most important parts of this wheel. And that's about the peaceful mind and the joyful heart and even the action steps. So a place where most physicians are comfortable, especially if they've trained in lifestyle medicine, is in this healthy body piece, which you see in the quadrant on the right, which is green. And we have physical activity, nutrition, and sleep in that. And for lifestyle medicine, those are three of our major pillars. We have 6 pillars, and the additional pillars are also in this wheel: stress, resiliency, and social support. The last one is avoidance of risky substances. And we talk about that in our energy piece. But let me get back to the importance of what we learned outside of our medical schools. So going to the peaceful mind, it's really important to honor our body, to work really hard, to move every day, to consume foods that are nutritious and delicious, and to get our sleep. Absolutely. But pieces of this puzzle that most physicians miss, because we're not trained in it in medical school, is this peaceful mind. Learning how to lower stress levels, learning techniques that last for months, as well as in the moment techniques like deep breathing. And perhaps we could do a 4-7-8 breathing exercise later if you all want it. But ways to turn off the sympathetic drive and get into the parasympathetic drive, meaning get out of this fight or flight and get into rest and digest. So we learned that. All three of us studied that. Then the importance of our attitude, the way we speak to ourselves, the way we look at life. You may have heard words make worlds. Our words make our worlds. So we've worked really on a growth mindset, on cultivating gratitude and positivity. And then, as Meredith mentioned, this really important piece of timeouts, taking a pause, taking vacation, unplugging.
The one I wanted.
A lot of different ways to talk about timeouts. And then I would say, well, look, I don't want to say the most important piece, but an under-recognized piece, which is becoming really, really powerful now in COVID and post-COVID, is a joyful heart. And the social support piece. We used to think, oh, yeah, talk to a friend. No, now we know. Connect with friends and family routinely. Really try to share your emotions, cultivate high quality connections, reach out. And even the power of this kind of grouping, and really the power of paving. And I know many of you have been in Amy's groups and experienced the social connections that are created during a group session. And then in that joyful heart, lastly, we have energy, natural sources of energy, almonds and nuts. There's a lot of magnesium. Magnesium is involved in 300 or more biochemical
I need
reactions.
to get out of it.
Bodies. And
Mary, can you go on mute? Sorry. Thanks, everyone.
And so cultivating, learning how to use what's outside of us and nutritious foods that give us natural sources of energy, and people. Like I see Amy, I see Michelle, and I'm immediately energized. Like this is a source of energy, natural energy for me. And hopefully you have friends that do that for you too. And by the way, Alexis is here somewhere too, is a medical student who's a little energizer bunny herself. And when you see Alexis, you also get energy. So, there she is. Okay. So there are just people in your world that give you this type of energy. And I'm going to end this with purpose. Finding your purpose. And this can change throughout your lifetime. Different ages and stages and conditions and times. We have a different calling, a different sense of purpose. And that leads us to our last 3 steps in our wheel. And those are action steps. So understanding the power and harnessing the power of these 9 steps is important. And then moving on them, making action steps. So setting goals, being inquisitive, experimenting with things. We are the experimenter and the experimentee. We are the subject of our own experiments every day, like coming to this meeting. Is this helpful to you? Do you enjoy groups like this? Do you want to research further the Ellie Fund and what it has to offer? That's experimenting. And then to sustain these kinds of behaviors, we need variety. That's what research tells us, as well as our own experience tells us. We can't have oatmeal every single morning, plain oatmeal every single morning, the rest of our lives. Although my dad did that after his heart attack and stroke. But most people need to put cinnamon, need to put blueberries one day, need to change it up a little bit. So that's our wheel, and that's our overall program. Thank you for the opportunity to share it with you.
That's so great. Thank you for explaining it to us. I'd like to ask Dr. Tollefson to start us off on a different topic, what you 3 call in your workbook, which I love, as live and learn. The messages that you've collected along the way that you want to make sure other people hear. And I think that Dr. Tollefson, your live and learn really is going to resonate with the patients that are on the call tonight. So I'd love to give you the floor, and I'll try and pull up my slide after you're done.
Oh, thank you for the opportunity to be here tonight. It's an honor to be here with all of you. So I'll read a live and learn that's in our Paving workbook. It seemed like every moment of my calendar was booked from the moment I woke until bedtime, often exhausted from caring for my 3 young children, a new puppy, and responding to student emails as a university professor. Taking time out seemed like a luxury that I just couldn't afford. Then I received the phone call that changed my life forever, when I learned that a routine screening mammogram had found a tumor against my chest wall. My well-planned schedule fell apart in a moment, as the next 7 months were filled with multiple surgeries, chemotherapy, and more doctor's appointments than I could ever have imagined. Initially, I fought to continue my pre-breast cancer schedule as much as possible. However, as weeks of chemotherapy progressed, I realized that I needed to rely on others, as friends delivered food and my family watched my children while I rested and focused on my health. Although I wish that it hadn't taken a cancer diagnosis to teach me about the importance of timeouts, I appreciate the power of timeouts to refresh me, to empower me to be more present with my family, and to give me perspective. Pausing and nurturing quiet times has allowed me to appreciate life and the people in it more deeply. Although my strength has returned and I can make it through my days again without timeouts, I continue to prioritize these precious pauses that help bring peace to my life.
Amazing. Thank you so much for sharing. I mean, really, bravo. And I think that maybe the one thing that maybe you can explain us tonight, how to take baby steps in finding out what a good timeout is for each individual person. Can any of you speak to that?
Sure, I'd be happy to share a little more. I know before timeouts really did seem like a luxury, but after that diagnosis, I tried to just keep pushing on, but then realized that I couldn't. And I think that often women, timeouts are seen as a luxury, are seen as self-indulgent, and we're busy taking care of everyone else. So when we get that cancer diagnosis, it gives us an opportunity to pause. It almost makes us, right? It makes us pause and kind of take stock of our lives and where we're spending our energy, because it's often more limited. But I think that mindfulness is a great place to start. I know when I'm starting to feel more tired, or when I'm starting to feel anxious and overwhelmed, that's when I try to pause and just be mindful of what do I need? What do I need? Do I need to be nourished with some nourishing food? Do I need more rest? What is it that I need in order to feel better again? And I also think that as cancer survivors, or those of us who have been through cancer, or who are dealing with cancer, I think that we can really role model this for other women, because I think we still live in a society that does not value timeouts or that minimizes many of these lifestyle behaviors as superfluous or things that are just the fluff that we don't really need. And so I think that we can help share the message that these healthy lifestyle behaviors are core and are central to our overall health and wellness. They don't replace what we do with medications or surgery or chemotherapy, but they are core to our health and well-being. And we can model that for women after us, for generation, or people after us for generations to come, as well as for women and other colleagues. But I would just encourage you to slow down, to use that paving wheel. And there is a great questionnaire that Dr. Beth Frates made, where you can go through, you can do an assessment of all of those different areas. And it's not that you need a perfect wheel. I don't think I've ever had a perfect wheel where it's all the same, but it is about what I need and what you need in that moment, and being mindful of it, and giving ourselves permission to slow down and to take care of ourselves and to prioritize that.
I think that, the mission of the Ellie Fund really resonates with what you're saying. Our mission is to reduce financial and emotional stress for the sole purpose that people can focus on their recovery. You're saying the same thing. Not everyone, sometimes you need help to relieve, to quiet one of those raging fires. And the Ellie Fund can come in and help do that for either 3 months or 6 months, so that maybe you can take one thing off the table and focus on your recovery. How do people start when everything is so, topsy-turvy? Where would somebody start to even do that?
Amy or Beth, do you want to take this question, or do you want me to jump in? I can share a little bit more. So I would say those small steps. So taking those small steps. If I try to look at the whole entire wheel at once, or I try to say I'm going to incorporate self-care in all the areas, it would seem overwhelming. So for me, it's that mindfulness of what do I need in the moment, and then maybe choosing just one of those areas and saying, okay, I'm going to work on my sleep. And so taking those small steps and setting small goals. In the workbook, we go over some of the basic information and content, but then we also ask some questions to help you really narrow in on what you can do. And then just setting those small goals and taking those baby steps. So maybe it's just getting to bed at a routine time, or maybe it's making your room, your bedroom darker and more conducive to sleep. But it's really, I think, not about trying to get all the way to the end, or to trying to be perfect, or trying to fit a certain stereotype of a healthy or an ideal person, but really just trying to look at ourselves and look at where we can just take one step that day by day, and then being gentle with ourselves too, and realizing I don't eat a perfect diet every day. I don't do the ideal exercise routine every day, and giving ourselves permission and grace to acknowledge our limitations and our struggles, especially as those of us who have gone through or who are going through breast cancer, but to really just kind of keep taking those steps day by day, and we'll see that progression. Amy or Beth, what are your thoughts?
I think those are really great points that you made, Michelle. And that's one thing I like about, I'm just holding it up, if you can kind of see it, there's in the back of the book, we do have the paving wheel that Beth created, which basically is a wheel like what we just saw on the slide. And you individuals who get the workbook or participate in one of the programs can fill out, sort of, as Michelle just stated, for each of those topics, sort of a little survey of how your own assessment of how you're doing. Thank you, Michelle. With each aspect of your wellness, such as physical activity, nutrition, time out, whatever that may be. And many of us, some of us, maybe I'm speaking for myself, think we should have the top score on every single thing. And that's just not the case for anyone. Nobody's going to be perfect at every single part of this paving wheel. We're all a work in progress. That's why it's called Paving the Path to Wellness. We're paving a path. And it's really, really useful to do this kind of exercise and just kind of see what areas you can work on and improve upon, and take it one step at a time.
That's great. I want to talk about self-care and what that means. Is it a manicure? Is it reading a magazine? I'm going to try and pull up our self-care slide. And I'm hoping that, we can talk a little bit about what that means. This is craziness. Help me out, Amy.
No, you got it. You're good. Oh, what you have the paving wheel. So
I know.
that's good. And then if you could advance it one, I think your self-care slide was.
Yeah, I'm looking at self-care. Are you not seeing that?
Oh. And I know Zoom can be so annoying sometimes.
I was looking at self-care. Sorry.
Sometimes you have to stop the share and then share again, and it might, if you're on that
Okay.
self-care, it might work.
I shall try. Anything?
Oh, you got it. Perfect. Perfect.
Go ahead, Amy.
Oh, I was just going to say you got it. And
Okay.
I love this slide because I mean, self-care, gosh, that comprises so many different things that are so important for our overall well-being, and especially women really need to focus on this topic. What I've seen in the paving groups that I've led with breast cancer survivors, and I see some friendly faces on this Zoom who hopefully will chime in, but I've had many instances where a woman will kind of chime in and say, you know, and I know, Michelle, you alluded to this as well. Like, I'm used to caring for everyone else. I care for the dog. I care for my kids. I care for my partner. I'm the one who does all the cooking and the grocery shopping and the laundry. And like many times these women don't really know what it means to take care of themselves. And I think that's really in our paving groups, that's really come to light. And I think doing this program has really helped many individuals realize the importance of taking care of oneself. Certainly a cancer diagnosis, you know, unfortunately, it's often a wake-up call. But, you know, when one is going through the cancer survivorship phase, it's really key to focus on these aspects of self-care. And I see a familiar person who chatted, and I'm going to call on her if she won't mind. I don't think. Linda, I hope you don't mind that I'm calling on you. There you are.
Hi.
Would you like to comment on that topic of caring for oneself after going through cancer treatment? Because I feel like you have some very strong beliefs on this that you could share with all of us.
Absolutely. Thank you. I'm honored to speak, and thank you everybody for this event. I love the Ellie Fund, and you guys helped me through cancer, so I really appreciate you. Yeah, self-care through cancer was really hard. I mean, I am a very energetic person, and I had never experienced the kind of fatigue that came with chemo. And it was really devastating to go through. And I think the biggest change for me, because I had already been a self-care aficionado, but the biggest change for me that cancer brought was to really ask for and rely on other people for help. And I'd never been that. I mean, you know, to some extent would lean on people, but not to this extent. I mean, I just had people helping take me to appointments and coming into our home and doing cleaning and bringing us meals and, you know, things that now I just feel like I see that as a very community oriented, wonderful thing to do, and just hadn't been part of my life before. But after cancer and through cancer, that was a huge part of self-care, was accepting help.
That's amazing. Thank you for sharing that. I'm so glad we were able to help you. And one thing about our patients that we've learned over the past 25 years is that it's really, really hard to ask for help. It's really hard to receive help. And that part of why people love the Ellie Fund so much is that you're not asking for anything. The Ellie Fund comes in and gives you what you need before you may or may not even know what you need, and that it's somewhat anonymous. And I think that for some people who have a really hard time accepting help, you know, find our services nice, that it's not your neighbor, it's not your friend, you know, it's just like this random sort of anonymous support. And I would just like to know if anyone else felt that, you know, it was hard to ask their community for help.
I think having gone through breast cancer, and I think one of the common denominators that I see now, having met women who have been through breast cancer, is we were the people that helped everybody else. So we are typically those people. It's definitely a type. You know, we're like the first to show up and the last to leave. And when you are in that place of vulnerability, I think one of the things that cancer taught me is you can be very vulnerable and still be strong. And I think that asking and receiving the help was really surprising for my group to see, like people in my foxhole, like they were like, is she even going to receive the help? I received it. One of my doctors, one of my surgeons had said to me, you know, you need to behave like a sloth in order to heal. And I really mean it. Like, you can't get up and kind of bounce back. And I listened to him. I don't know why, but I was so grateful that I did. And I would have friends come and visit and people, and I just took time for the first time in my life ever. So again, like Amy said, like the silver lining type of situation. I don't know if you want to call it that, but anyway, sorry. That's Douglas. That's my cue.
Control your dog.
Thank you, ladies, for this amazing book.
I want to take a moment and see if there were maybe any questions that you wanted to ask specifically of the three doctors, because I know this is you don't always get access like this in an open, relaxed forum. So please put your questions in and we will read them and let them speak. Dr. Comander, while we're waiting for that, would you tell us about your live and learn about sleep? Because that to me is the thing we can control the most that doesn't involve exercise or nutrition or avoiding substances. Talk to us about sleep and how is that important when you're going through a disease like this?
I love that you said that's something we can hopefully easily control, because that's, while I did write the live and learn on that, I will say that on my paving wheel, my worst topic was sleep. So that's because, anyway, you kind of alluded to it earlier. I try to pack in too many things, but I did write a live and learn about sleep because certainly as we wrote this book, you know, doing a lot of research on, it's actually called sleep hygiene. It's kind of a funny term, but good practices that we should follow to help ourselves achieve good quality sleep. And so in learning about that, I really tried to make a lot of these changes in my own life to help myself obtain quality sleep, which we know is so important for our overall health. So, you know, it's a long passage. I don't think you want me to read the whole thing.
No, I want to know. No, I want to know what you did. What did you do?
Well, I'll tell you one thing I did do, which I still do, which again, don't always listen to it, but you know, on your iPhone, not only can you set your alarm in the morning when you need to wake up, but you can set a bedtime alarm too. So if you know you're trying to get 7 hours, 8 hours of sleep, whatever that may be, if you know you're getting up at a certain time, you can set your phone to tell you, you know, in the evening, time to go to bed. And you may choose to listen to it or not, but it is a really helpful tool that I've found to be useful. And I've certainly shared it with many of my patients, but I'm open to other suggestions from others on this Zoom about how to really improve sleep quality. It's funny that you asked that because last night in our paving group, that was the topic, sleep. And so we had an expert join us to really delve into that further.
Are paving groups available for people who want to join them? How would a patient access that?
Great question. So currently the group that I'm running through the Mass General Cancer Center is for patients at our hospital, but I would love for Dr. Frates to address that further. You know, how we hope at some point to be able to make this more accessible. Why don't you comment further?
Okay, terrific. Yeah, that's a great question. And thank you, Meredith, for giving us this opportunity and also for speaking with us earlier today so that we could make these programs more available to people nationally, globally. So the silver lining of COVID has been this, that we can communicate and connect with people from around the globe just with a click of a button. So knowing that, Michelle, Amy, and I are in the process of making videos and creating a program that you could do from home. Now, this won't be including the community, but this is one step. We'll have videos that you can do, and you can follow the workbook and then click on the video. And it will hopefully feel like you're with us. It will be a personalized approach with the video. That's one. Two, we are hoping to run more of these. Michelle will be running some. And again, since it's by Zoom, you would be able to join in, even though Michelle is in Colorado. So Others will be able to hopefully get trained. And the three of us will be training people in Paving the Path to Wellness programming. So other clinicians, physicians will be able to lead them. So we'll have more options available. We'll also think about a hybrid option where you would be able to watch the videos, work with the workbook, and then also connect with a community. So we're working on that right now to make more and more of these available. Currently, Amy is running one. You do two a year, right, Amy, right now?
Yeah, currently we're doing it. It's a 12-week program. So it's a wonderful, as some people on here can attest, but yes, twice a year at the present time.
That's wonderful. Thank you so much. I really appreciate it. I want to just understand, in the medical, with all of our patients, they spend time with their doctors. They have limited amounts of time for questions. If they don't hear their doctors asking them about wellness and sleep and do they have enough food, like, where is that in the medical, where is that in the visit from the doctor's perspective? And what should a patient say if they want to start that conversation about things outside of medical treatment?
That's a great question, Meredith. I'm happy to take it first. And I think what you just said, I mean, those are very fundamental topics that certainly, I mean, I hope most of my colleagues are asking their patients those questions because, it's very important to make sure some of those basic needs are being met. How are you eating? How are you sleeping? How is your energy level? How is your anxiety and stress level? I mean, there's actually guidelines, which is a good thing, from organizations such as the National Comprehensive Cancer Network and other organizations, that all cancer patients at every appointment should be screened for distress, which is sort of the stress, essentially how we think of stress, but the negative aspects of stress. So, and of course, all the other topics that you mentioned are so important. So I personally think all of those should be addressed at every visit. It is true, we have limited time. We don't always have time to really get into, let me counsel you about your exercise habits. And, we don't have time for those kinds of things. And that's why there's such a need for programs like Paving. But in terms of those basic needs, like, do you have food? Are you sleeping? Those kinds of things. I mean, those are things that we all should be paying attention to at every visit, I hope.
I think that's really important. Our patients, many of our patients have been in situations where they haven't had enough money to pay for the transportation to get to the doctor, or they haven't been able to take off work because they need the hours to pay for groceries. And, it's our hope at the Ellie Fund that, and someday, it will be these access to care will be part of the treatment. And we're hoping that we can move the needle on that, because those barriers to treatment exist and we're removing them, but we want to remove them for more people. We're not going to be able to change them. So I'm really glad to hear that you have those conversations constantly. And I hope that if someone's doctor doesn't bring it up, that our patients feel that it's appropriate, okay, and probably a really good idea to bring it up. We have a question from Linda. Do you see lifestyle medicine gaining more influence in the medical community? This is great. It makes sense to help the whole person. And I just wonder if your physician colleagues express curiosity and interest in adopting the principle of lifestyle medicine or paving. What a great question.
Should I take that one?
Sure.
Okay. So that is a great question, Linda. And the answer is yes. So the American College of Lifestyle Medicine was founded in 2004. And now we're 2021. And so almost 2 decades later, but you need to know, we've come to a peak, but you need to know that about a decade ago, we almost went belly up. There were like no members and then no funding. There's like 20 people at the annual meeting. We just had our annual meeting 2021. We had 2,000 people. Now it was by Zoom, so that anyone could join. So, but still 2,000 people were interested, and no worries about membership. 7,000 members now. The American College of Lifestyle Medicine. We are the fastest growing college in medicine at the moment. So yes, indeed, Linda, people are very interested. Physicians, nurse practitioners, nurses, physical therapists, dietitians, fitness professionals. So they're all really interested. And moreover, they've spent significant time, energy, and money to be certified in lifestyle medicine. There's 2,000 clinicians now certified in lifestyle medicine. And the exam started in I think the first round was 2018. I actually wrote the questions for the board exam, and I think it was 2017 with 3 other people. So we didn't know, were people going to take this? Are they going to be interested? And guess what? Yes. And at MGH, Amy is, of course, one that is board certified. And I believe there's 2 or 3 others, but at least 10 or so, I hear, will be, hopefully, if they pass the board. We know that there are several colleagues sitting for the boards from MGH. And in fact, this morning, Linda, it's almost like you have X-ray vision, or I don't know, you know, you can see in the future, who knows? But this morning we had a meeting with MGH clinicians who were asking about doing this and doing more of Amy's programming for not just breast cancer survivors, but for all cancer survivors. So absolutely, we're in a real peak with lifestyle medicine, a lot of momentum, maybe thank COVID. I don't know, or just people waking up to the fact that what they do day in and day out, how they move their bodies, what they put in their mouths, how they sleep, how they think, how they breathe, has an impact on their health and well-being.
I want to ask a follow-up question from one of our participants tonight. If you are a Mass General patient, how do you sign up for Paving?
Great. I did see that question as well, and I did reply, but I can.
Oh, okay.
No problem. Like there's, you can mention it to your oncologist, who can easily refer to the program, or we're working on updating the website at MGH. So it's a work in progress right now, but that's probably the easiest way. But to the person who posed that question, I just gave her my email.
Okay, that's great. Oh, thank you. So one more question about sleep. And I realize you can't give medical advice to any of us, but what kinds of questions should people be asking their doctors if the question was that they've been trying to sleep without medication now that she's finished chemotherapy, but it's been inconsistent success? How do you decide whether you should start with medication or keep trying? What are the questions that she can ask her doctor?
I'm happy to take this on because we discussed this actually last night, and I'm looking for her, Alexis, our medical student. If you want to chime in, if I missed something, please speak up. But we had a psychologist join us whose expertise is actually helping cancer survivors manage insomnia and other types of sleep disturbances. And certainly, you know, many of our patients do require various medications to help with sleep during treatment. A lot of, you know, chemotherapy, steroids, a lot of those medications can make it very difficult for patients to fall asleep. And therefore, of course, medications are often needed to help with that. But certainly over time, it's probably good to come off of those medicines. And certainly it does take time because your body may have gotten very used to those medicines for sleep. And therefore, Dr. Daniel Hall, my colleague who joined us last night, is really pioneering the use of cognitive behavioral therapy for insomnia, specifically directed to cancer survivors. And he's developed a really novel virtual intervention that's been very successful. And he presented it last night, as well as some like very key tips for the people on the Zoom last night to help them improve their sleep habits. And so there are definitely strategies that can help you. And I would certainly talk to your doctor about that and see how you could potentially get referred to someone to help you improve your sleep habits. And Alexis, if you want to add anything, there you are, from Dr. Hall's presentation, you're welcome to chime in.
Yeah, I don't have too much to add. It was great. And I think it's a question that a lot of patients are asking because so many different things affect our sleep. And I think his major takeaway about medications are that they're one tool and they work for some people. And, you know, like all medications, they have their own side effects and the ways that they affect sleep that we might not even understand yet. So it's one of those things where you can kind of examine your toolkit and see which tools might work for you and what might be feasible for you in your schedule with sleep hygiene. You know, what are you doing before bed? He was talking about activities in your bed, like trying not to work in your bed. There's all of these different pieces of the puzzle, and with medications kind of being one of them. And if that is the only tool that works for you, then that is, you know, the tool for you. But he really empowered us to think about all of these other things that go into sleep that we're learning about as a like scientific community and as a community at large, that I found really empowering. So it's worth
That's
exploring
great.
more and kind of asking your doctor.
I think it's worth doing an Ellie Connects on breast cancer and insomnia is what I took away from that, because I think it affects a lot of people. And speaking of future topics, you know, we really want to hear from you about what you think would be helpful. And I know we're going to have most of the doctors that are here tonight back for later episodes, so I hope you'll stay tuned. I just want to say a word or two about Ellie Connects for 2022. We're going to try really hard to increase the amount of these conversations that we have. We think they're useful, they're accessible, and you know, even there will be some that are really only appropriate for people going through treatment, and there will be some that are really appropriate for caregivers or anybody who wants to learn. In January, we are going to hear about choosing the best insurance while you're going through a disease, or if you are about to be faced with a change of your insurance and you're being treated for a chronic disease, what should you be looking at? And so we're going to have some experts talk about that, and we'll get you all the dates for early January. We'd like to have one with surgical experts to talk about latest techniques and what's happening in the surgical field. We definitely want to have one about being a caregiver and then becoming a patient, and invite all of the people that are helping you as caregivers to talk to them about what the breast cancer experience is like from their perspective and how we could be helpful. We want to talk about parenting through breast cancer for sure. And now we're going to talk about cognitive behavioral therapy in breast cancer, because I think there's value there. And also the importance of bone health in breast cancer and what happens to people's bones after they've been treated with pretty heavy duty chemicals, and what you need to do to protect yourself. So we're collecting all these topics. We want to know what would be meaningful to you. They will always be free. They will always be, you know, hopefully in person one day. And so please, you know, sign up for emails and definitely follow us on social media, just so that you're aware of the Ellie Connects topics. And I would like to show you the book you've all seen. I'm working through it myself. I have horrendous sleep problems. And I think that we have a code for free shipping. And so I think, Kristen, did you put that in the chat? We do not want to pay for shipping. So let's see.
I did, but I'll do it right now again.
Okay, great. So we will, if there are any current patients on this call right now, again, who want to identify themselves, I have 5 books that have been donated by these fine women, and we will get them to you as soon as possible so that you can, you know, give yourself a gift and start taking small steps to improve your wellness. We have a minute or two. I just want to make sure there weren't any questions that I missed, or if anybody wants to ask, feel free to. But we will get you a book, Joanne. Absolutely. Just put your name in and how we can find you, and we will send it to you. And there are other Ellie Connects that we have done. We did one about friendship, how to be a good friend to someone going through breast cancer. And what was the first one we did? Or that was the first one. What was the second one we did? Can't remember.
They went on exercise. Remember, we did.
Yes, exercise. So we're going to keep doing this. We're going to keep doing this, and as long as you think it's helpful, and we want to wish everybody a very safe and healthy new year. If you are in treatment, if you know someone in treatment right now, put your name and your email in that chat. We want to make sure you're being served by the Ellie Fund. We want to make sure you're getting 2 services from the Ellie Fund. If you only signed up for one, we're going to talk you into a second. And if you have any friends or colleagues that might need us, to always give a warm invitation that you know the Ellie Fund and that you have friends there and that we want to help. So to the three amazing physicians, thank you so much for sharing your expertise with us. I think we all are in awe of what you do to take care of patients, and the fact that you believe nurturing the soul is just as important as the appropriate medical treatment. Amy, I'm just going to ask you to close it out with some remarks, since you brought together these awesome women, and then we will shut it down.
Wow. Well,
I'm putting you on the spot.
I can't, no, it's okay. It's hard to believe it's 7:52. It goes by fast. Well, first of all, Meredith, I think all those topics you just outlined sound amazing. I love the topic Ellie Connects, just bringing everyone together and forming this community, because we're all so grateful to everything that the Ellie Fund does for individuals with breast cancer. So thank you. And thank you for giving me, Dr. Frates and Dr. Tollefson, the opportunity to join you tonight and speak a little bit about our passion, which is, of course, helping individuals achieve optimal wellness. And that's why we wrote this book together. So it's really been a gift to join you all tonight. Thank you.
That's great. Thank you. Thank you, everyone. I know the patients that said they'd like a book. We will get it out to you right away. And I hope you'll join us for our next episode of Ellie Connects. Thanks, everyone.
I'd like to get that book.
Thank you.
Thank you.
Thank you.